Good day everyone. I am Maricel Anki, an AMDNA student, and today I will be going to demonstrate about wound care. So, wound care is a procedure where we need to clean the wound area or to check up it for the patient's goodness. So, first step to do is to review the medical orders for dressing change procedure. So we need it to check first. After checking the medical orders, next step is to explain the procedure to the patient or client, and then make sure to remind the patient not to touch the wound area so that it will not be contaminated or the sterile supplies here. So, good morning, ma'am.
Good morning.
I am Maricel Anki, your nursing assistant for today. So, what is your name, ma'am?
My name is Maria,
Age?
30 years old.
So today I will be going to do a wound care. Is it okay to you, ma'am?
Yes.
So I just want you to inform ma'am that please do not touch the wound area and the sterile supplies. Is it okay, ma'am?
Okay.
Okay, thank you. Next step is to close the windows or the cubicle curtains to provide privacy to the patient. So, if there are curtains, you need to close it. And then the next step is to position the patient comfortably and drape with a bath blanket to expose the wound area. And next, place the waste receptacle within reach area or paduol sa kanang makabuot ra nga mabutangan. Don't forget that you will give a space so that the bacteria will not go to the wound area. Next step is to apply a face mask. And then the protective eyewear if required, and wash hands thoroughly. So we need to wash our hands and then sanitize our hands. So after sanitizing your hand or after hand washing, you need to wear or put a clean disposable gloves. Make sure to locate your hands while putting your gloves so that you won't have any difficulties for wearing this. And then next step is to remove the tape, bandage, or ties. So we need it to get with the comfort. And then remove the tape. Remove the tape, pull parallel to skin, pull toward dressing, and then remove the remaining adhesive form skin. And then put it on the waste receptacle. With the glove, gently or carefully remove gauze dressing one layer at a time, taking care to dislodge drains or tubes, or keep soiled or keep soiled under safe away from clients tight, or you need to be careful by removing the gauze. And then put it on the waste receptacle. If dressing sticks on a wet to dry dressing, do not moisten it. So instead, gently free dressing and alert client of potential discomfort. Next step is to observe the character and amount of drainage on dressing, appearance of wound. So we need to observe the character so that we can write and report to the doctor. And then next step is to dispose the soiled dressing on the waste receptacle. We need to be careful by getting the solid dressing, and put it on the waste receptacle. And then next step is to remove the gloves. By pulling them inside out. So you need to be careful by disposing or removing your gloves. And then dispose it in the waste receptacle. And then next step is to open the sterile dressing tray or individual wrapped sterile supplies, and then place it on the bedside or in the work on the work area. So this is my dressing sterile supplies. So I need to put it here on the bedside. And then next is to apply the dressing. And now let's proceed to the dressing. So after I proceed to dressing, please allow me to introduce the materials that I will be using right now. So I have here my betadine solution, the adhesive tape, the sterilized gauze, the clean the sterile gloves, and the forceps. And then I have also my waste receptacle and a bottle and a basin. We have the two types of dressing, the dry dressing and the wet to dry dressing. So um, I will just I will just I will just demonstrate first the dry dressing. So first step is to open a bottle of solution if ordered. So the solution that I will be going to use is the betadine solution, and then I will be going to pour it into a sterile basin. I will put the as what prescribed. I will put um, a latol. And then sanitize your hands. Sanitize, and then next step is to apply the sterile gloves. Then make sure to dislocate your sterile supplies to your waste receptacle so that it won't be contaminated. Then put it in the waste receptacle. So by wearing or putting your gloves, make sure to hold the do not to hold the sterile area of the gloves. So you need to locate your hands so that you won't have any difficulties. And then next step is to inspect the wand for appearance, grains, and integrity. So we need it importantly, and avoid contact with the contaminated materials. So after checking or inspecting the wand, next step is to cleanse the wand cleanse the wound with this solution. So we we should use the sterile picking forceps. This is my alternative, or the improvise, and then the cotton ball, and then put put the a betadine solution as what I put in the small basin before, and then use a separate swab for each dressing stroke. So you need to use the one firm stroke, and then put it in the waste receptacle, and then use also another one. Clean from least to contaminated area, most contaminated area. Put it in the waste receptacle. And then next step is to use the dry gauze. Use the dry gauze to swab in same manner as what I do in the cleansing the wound. Use the one firm long stroke to dry. Then put it on the waste receptacle, and then you should also use another sterile gauze, and then dry also. Then put it on the waste receptacle. And the next step is to apply ointment. Apply antiseptic ointment if ordered, using same technique as for cleansing. So you need to I need a cotton, and then put on the one, and then use another cotton, and then put an antiseptic ointment, and put it on the waste receptacle. And the next step is to apply sterile dressing to incision or wound. So we need to apply a gauze, this sterile gauze, woman gauze as contact layer. And then also cut 4x4 gauze, the flat, to fit around drain if present. So this gauze is size by 4x4, so I want to cut this, then put it, and then pre-cut the gauze if available. And the next step is to apply the second layer of the gauze. Then apply thicker woven pad. Then put a adhesive tape. So make sure to put adhesive tape carefully. So that's all for the dry dressing. So after you do the dry dressing, you will you will get your gloves disposed on the waste receptacle, and then clean the area after you leave, and then sanitize your hands or wash your hands, and then record your work. So after doing after demonstrating the dry dressing, let's proceed to wet to dry dressing. So first step is to pour a prescribed solution into sterile basin and add fine mesh gauze. So this is my sterile basin, and then put a solution, betadine solution as prescribed by doctors, and then put a fine mesh gauze, wet fine mesh gauze to the basin with a solution. And then next step is to put gloves on your hands, or to apply sterile gloves. So on applying the sterile gloves, so make sure that you won't touch the sterile area of the gloves. By entering your hand to the gloves, make sure to dislocate your hand so that you won't have any difficulties. After inspecting the wound, next step is to cleanse the wound area with the prescribed. So put a prescribed solution. So in cleanse the wound with the prescribed antiseptic solution or normal saline. Use the firm long stroke. So use one cotton by one side. Then use another one for the one side also. And then clean. I'm cleaning it from least to most contaminated area. So after apply moist free mesh. So this moist gauze wet as a single layer directly onto one surface. So I will just fold it because the wound is not so big. And then if the wound is deep, gently pack into wound in anaon o if dalom ang samad, like this, if lalom ang samad with forceps until all wound surface or in contact with moist gauze, so in anaon. So if dili ra in anaon ra, then put the fine mesh gauze on the wound area. And then next step is to apply gauze, the 4x4 sterile gauze over wet gauze. So this apply, so this is 4x4, so you won't have to cut this. And the next step is to put adhesive tape over the dressing. So after putting a adhesive tape, remove the gloves and put it on the waste receptacle. And then after removing the gloves, remove the eyewear and then the face mask. And then sanitize your hands. And then next step is to assist the patient to a comfortable position. Making sure that he or she will be fine and comfortable on his or her position. And then next step is to dispose the materials or the supplies. Dispose, put all the materials that will be disposed, throw it in the proper disposable area, and then return the equipment that's being used to the proper place. So after disposing the supplies, next step is to wash your hands, and then after washing your hands, record your work. That's would be all. Thank you.